Hi, my name is Ruben Gobezie, and I'm the director of the Cleveland Shoulder Institute here at Lake Health System. I look forward to talking to you over the next few minutes about some of the most common shoulder disorders. Shoulder arthritis is a very common disorder in the population. Arthritis affects more people and disables more Americans than any other musculoskeletal disorder in the United States. The most common question I get about arthritis is, what is it? What is arthritis? And a lot of people have all kinds of ideas about what arthritis means to them. Let me share with you an easy to understand definition of arthritis. Every bone in the body that comes together is called a joint. We see two bones come together, we say they join. And where they touch, the surfaces where they touch, are covered with a tissue called cartilage. Cartilage, if you were to hold it up and look at it, looks like the outside of an eggshell. It's white, it's smooth, and it's lubricated, so you, just like when you were 18 or 16 and you could move everywhere very easily, it allows for easy, frictionless motion between the two surfaces touching each other. When you lose cartilage, when you wear it off, the ends of the bones, where they touch in the joint, we call that arthritis. Arthritis is the loss of cartilage. So a lot of people say, can arthritis come back, and so on and so forth, or I'll clean out arthritis. And the reality of it is, once you understand what arthritis is, the loss of that surface covering, that cartilage, you understand that it's impossible to clean off something you lose, right? So arthritis means a loss of cartilage, and when you lose it, two things happen in every joint. From the small joints like your hands to the big joints like your hip, you lose range of motion, you become stiff because you get what's called, and we've all heard this, bone on bone. You've worn out the surface covering of the joints where the bones come together, and now the bone on bone is more like sandpaper on sandpaper. It doesn't really move very easily. And so people will often have stiffness with arthritis of the shoulder, and it comes from the loss of the cartilage. The second thing that people will complain about is pain. And it's a very peculiar type of pain. It's an ache. Most people will say it feels like a toothache in their shoulder. Typically, in the morning, when somebody wakes up with an arthritic joint, they have what's called morning stiffness. It's very stiff and it's sore, and it's almost like they have to use it for a while before it loosens up. As the day goes on, the person feels better, but at nighttime, it'll typically ache like a toothache or throb in the shoulder or the hip or the knee after use. So I call it a pay-to-play phenomenon. As you use your arm, you can do that when you have arthritis, but later on, you may not feel like using your arm for a few days, or a few hours. So that's what arthritis looks like. That's what arthritis is. And now you come to the treatment. We come to the treatment. How do you deal with this? Well, I tell people there's a few things you have to understand about arthritis in order to understand its treatment. The very first thing to understand about it is that though I told you arthritis is the loss of cartilage, I did not tell you the truth about it, which is that there are many different kinds, or I should say, many different ways to lose cartilage. You've heard of things like rheumatoid arthritis, osteoarthritis, traumatic arthritis, and so on. There are different ways to lose cartilage, and therefore we give them these different kinds of names. Each of those different kinds or ways of losing arthritis has a kind of different look to it. In other words, how fast the arthritis or pain and stiffness progress varies from person to person. And that's a result of there being different kinds of arthritis. So therefore, how you treat that person who comes in is based on what kind they have, what kind of presentation they're coming. In general, it's fascinating to me as a physician. I never get tired of assessing the person's need when they walk in and trying to understand what kind of arthritis is that person bringing to me today, and how can I help them get better and deal with that individual problem. So I'll give you an example. Some people, and I would tell you, I generally break down arthritis into three groups of patients. Okay, one is the average 60%, let's say anecdotally, of people who come and have some combination of both pain, the throbbing toothache we talked about, and stiffness. Doctor, I can't move my shoulder very well and it aches, okay? That's the majority of people. Let's anecdotally agree, somewhere like 60%. The other group of people, which are a minority, but not so small, 15 to 20% of people, are amazing at how in their difference. For example, they have excellent range of motion. If you didn't look at an X-ray or an MRI of their shoulder, you would never guess they had arthritis, except that they have the ache. They have excellent range of motion with an ache. The other 15 to 20%, the third group of people, have very little pain. They don't have the ache. They will even deny having pain. They'll say, it didn't hurt that much. They have terrible function. The range of motion, in other words, is very poor. So each of these people, some people come with the majority with some combination of pain and stiffness. Other people come with primarily pain and no stiffness, meaning good function. And other people have terrible function and no pain. And clearly the treatment for these are different. You can't put them all in the same group, because some people, for example, the person with very little stiffness and a lot of pain may respond to cortisone shots, which are steroid anti-inflammatories that reduce the pain. Could respond to regenerative therapy, which is something like a platelet-rich plasma, which is a blood product that we now use. It's on the cutting edge of the treatment of arthritis, and we'll talk about that in my section on regenerative medicine. Or you can go to Regen Orthopedics, REGEN orthopedics.com. But the concept is you want to look at the regenerative therapies in those patients, such as stem cells or platelet products. But the other thing you can do is gel shots. So there are different ways to maneuver based on what the person brings to me at any given time with their shoulders. Most people will have a response to one or other of these initial, what we call conservative treatments, non-surgical treatments. People will often ask me whether therapy has a role in it. And I think for arthritis, therapy helps in the early phases, not in the late phases. Early phases means that the range of motion has not been reduced substantially, and the ache in the shoulder is not constant. That's what we call an earlier phase of arthritis. Of course, that means later on, the range of motion for most people is substantially reduced, and the pain ultimately becomes constant. But in the earlier phases, you can have gains in range of motion for those people who are suffering from loss of range of motion, and some gains in pain early. Later on, if you try to apply the same tactic, it actually worsens the symptoms. So again, phase of disorder is a big deal, and the kind of disorder, the kind of arthritis they have is a big deal. So it's not a one-size-fits-all analysis, in my opinion. I really try to look and figure out each of these factors for a person coming to arthritis. Ultimately, though, unfortunately, we don't have a cure for arthritis, so many people will progress towards a joint replacement eventually. And that's driven really by a combination of factors, mainly what the person needs in terms of functional and pain relief, and how they respond to the other non-surgical measures, which are always important to employ before considering a surgery. And the good news about all of this, the good news, if you will, about the bad news of surgery, is that it works. For the vast majority of patients, joint replacements have revolutionized the care and quality of life for many, many people suffering from arthritis. And I can tell you, my happiest patients are often my joint replacement patients, because by the time they come to me for a joint replacement, most of the time their quality of life has suffered so that the replacement is a life-changing operation for them. It improves their pain, it improves their function, and one of the most exciting areas for me in terms of the surgical treatment of arthritis is the fact that I've really helped pioneer outpatient joint replacement surgery. I've done more outpatient joint replacement surgery, outpatient shoulder replacements than almost anybody in the United States. And I've learned a lot about how to get people through shoulder replacement surgery as an outpatient. And I think that's really dramatically impacted how people experience shoulder replacements, meaning how they recover and what it's like to go through it, has become a lot less onerous, a lot less difficult because of that. So a lot of exciting things. I really do feel each year, as we get better and better at understanding regenerative therapies, as we get better and better at understanding operative techniques, we're able to really bring value to patients who are suffering from arthritis in the shoulder. Thanks for your time.